Hey there! Welcome to your personalized deep dive. Today, we're going to be tackling a topic that's clearly important to you.
Yeah.
Multiple myeloma.
Yes.
And hold on to your hats because we're even going to be exploring its potential connection to fasting.
Wow.
You've sent us some fascinating research articles, even some personal questions. Looks like you're really ready to get informed.
It's an intriguing mix for sure.
Yeah.
We'll be navigating some complex medical territory, but also considering the potential for lifestyle choices
Yeah.
play a role.
Okay, so before we get into the potential impact of fasting, let's make sure we're all on the same page.
Right.
What exactly is multiple myeloma? It sounds pretty serious.
You're right to take it seriously.
Yeah.
Multiple myeloma is a cancer that affects plasma cells.
Okay.
Those little antibody factories in your bone marrow that are crucial for a healthy immune system.
Right, the ones that fight off those nasty infections.
Exactly. But in multiple myeloma, these plasma cells go rogue, multiplying uncontrollably, and that throws a wrench into the entire blood cell production process.
And that's where the problems start, right?
Yes.
My notes mention anemia, infections, even bone damage.
You've been doing your homework. Anemia, the shortage of red blood cells, leads to that constant fatigue and weakness.
Right.
Then there's the weakened immune system leaving you vulnerable to infections.
No.
And on top of that, multiple myeloma attacks the bones, causing pain fractures and even osteoporosis.
So it's like your own body is turning against you.
Yes,
That's a scary thought.
it is, and it makes early diagnosis absolutely crucial.
Speaking of diagnosis, you mentioned a bunch of tests in your notes. What can someone expect if they're being checked for multiple myeloma? Paint us a picture.
It starts with blood and urine tests,
Okay.
looking for telltale signs, like the presence of an abnormal protein called the M protein,
Okay.
a sort of myeloma calling card.
So it's like a fingerprint at a crime scene pointing to the culprit.
Precisely. Then comes imaging X-rays, MRIs, CT scans, all used to assess the extent of bone damage. But the gold standard, the definitive test, is a bone marrow biopsy.
That sounds a bit more intense than a blood test.
It is more invasive, but it gives doctors a clear picture of the bone marrow environment,
Okay.
confirming the presence of myeloma cells and identifying the specific type of myeloma.
Right.
This is essential for crafting a personalized treatment plan.
Okay. So diagnosis is a multi-step process.
Yes.
And once it's confirmed, what are the treatment options?
Yeah.
Because from what we've discussed so far, this isn't something you just wait out.
Absolutely not.
Yeah.
The good news is multiple myeloma treatment has come a long way.
Okay.
We've moved beyond a one-size-fits-all approach to more targeted therapies.
Okay.
For example, bortezomib,
Right.
which you mentioned in your research,
Mm-hmm.
directly attacks the molecules driving cancer growth.
It's like a sniper taking out the enemy's command center.
That's a great analogy. Then there's immunotherapy,
Okay.
harnessing the power of the patient's own immune system to fight cancer cells.
Wow.
It's like giving their natural defenses a supercharge.
That's incredible. And I've also heard about CAR T cell therapy.
Yes.
That sounds pretty cutting edge.
It is. It involves genetically modifying a patient's T cells to turn them into precision-guided missiles targeting myeloma cells.
Wow.
It's at the forefront of cancer treatment.
That's amazing.
But we also still have the more established options: chemotherapy, stem cell transplants, and radiation therapy, each playing a role depending on the individual case.
It's encouraging to hear there are so many options,
Yeah.
especially those high-tech ones.
It is.
But even with all these treatments, I imagine there can still be complications.
Unfortunately, yes.
Yeah,
We can't sugarcoat that multiple myeloma can lead to some pretty serious issues.
right.
We've already touched on bone damage, but it can go far beyond just aches and pains.
Okay.
We're talking fractures, even bone collapse in severe cases.
Wow.
Then there's the impact on the kidneys. High levels of calcium and that M protein we talked about can damage the kidneys, potentially leading to kidney failure.
That's a lot to handle. It really underscores how this disease can affect the entire body.
It does.
And speaking of whole body impact, my notes mention amyloidosis.
Right.
What exactly is that?
Amyloidosis is another serious complication.
Okay.
It's a condition where abnormal proteins build up in organs, disrupting their function.
Right.
These proteins are often produced by the cancerous plasma cells.
So it's like a byproduct of the myeloma wreaking havoc elsewhere in the body.
Exactly. And the symptoms depend on where this protein buildup occurs.
Okay.
We're talking about heart problems, kidney issues, even neurological problems.
Oh.
And here's a detail that might stick with you.
Okay.
Some people with amyloidosis develop what's called raccoon eyes.
Raccoon eyes. Okay, now I'm intrigued.
It refers to dark circles around the eyes caused by bruising from amyloid deposits in the blood vessels.
Oh, wow.
It's one of the more visually striking symptoms.
Okay, that's definitely an image I won't soon forget. But back to complications.
Right.
There's one more on my list that sounds particularly frightening. Hyperviscosity syndrome.
Yes.
What exactly does that entail?
It's essentially a thickening of the blood.
Okay.
Due to those high protein levels we've been talking about.
Right.
This thick blood struggles to circulate properly, potentially leading to symptoms that mimic a stroke.
Wow, that's terrifying. This really paints a picture of how complex and serious multiple myeloma can be.
Yes.
It definitely highlights why seeking expert medical care is so vital.
It is.
But now let's shift gears a bit and talk about something you're probably very curious about.
Okay.
The potential role of fasting in managing multiple myeloma.
Right.
You included some very interesting research on this.
This is where things get really interesting, and there's definitely a lot of promising research emerging.
Okay.
Particularly on intermittent fasting.
Right. That's the one where you cycle between periods of eating and not eating.
Yeah.
But how could that possibly help with something as serious as cancer? It seems almost too simple.
It might seem counterintuitive, but there are a few key mechanisms at play.
Okay.
One of the most fascinating is autophagy.
Autophagy. Now that's a new one.
Yeah.
Break it down for us.
Think of it as your body's built-in cleanup crew.
Okay.
It's essentially the body's cellular recycling system.
Okay.
When you fast, it kickstarts this process, prompting your cells to break down and get rid of any damaged components.
So it's like hitting the reset button on your cells, getting rid of any junk that might be contributing to the problem?
Exactly. It's like giving your cells a chance to spring clean and declutter.
I like that.
And there's evidence suggesting that this process might make cancer cells more vulnerable to chemotherapy,
Okay.
while simultaneously protecting healthy cells.
Wait, so it could make treatment more effective? And do you have fewer side effects?
Potentially.
That sounds almost too good to be true.
It's still an area of active research, but the initial findings are very encouraging. And we can't forget the general anti-inflammatory effects of fasting.
Right.
We know inflammation plays a role in many diseases, including cancer. So anything that can help tamp that down is a plus.
That makes sense, but I'm still trying to grasp how fasting could help the bone marrow specifically.
Okay.
Which is ground zero for multiple myeloma.
Right.
You mentioned something about stem cell activation in your notes.
Ah, excellent question.
Yeah.
You're really diving deep here.
Why try?
There's research indicating that fasting might activate stem cells in the bone marrow.
Okay.
Remember, stem cells are like blank slates,
Right.
capable of developing into any type of cell, including those all-important healthy blood cells.
So it's like giving the bone marrow a boost, helping it replenish those healthy cells that are being crowded out by the cancerous ones.
Exactly. It's a potential game changer.
Wow.
And if we connect this back to the complications we discussed earlier,
Right.
it's quite remarkable.
Yeah.
Fasting could potentially address anemia by increasing red blood cell production, reduce the risk of infections by supporting white blood cell production, and even help with bone damage by promoting bone marrow regeneration.
Wow. So it's like a multi-pronged attack tackling multiple myeloma and its complications from various angles.
Yes.
That's incredibly promising. And let's not forget the general health benefits of fasting. Things like weight management, blood sugar control,
Right.
even potential benefits for brain function.
Absolutely.
It's not just about fighting cancer. It's about overall well-being.
Precisely. It's a holistic approach, and that's what makes it so fascinating.
Okay, this all sounds very exciting, but I know you're going to bring us back down to earth with a reality check.
I am.
What are the challenges and considerations when it comes to fasting, especially for someone with multiple myeloma?
You're absolutely right. We need to be cautious and balanced here. First and foremost, fasting is not a cure for multiple myeloma.
Right.
It's not a magic bullet that replaces conventional medical treatment.
So it's a complementary approach, not a replacement.
Exactly. And this is where medical supervision becomes absolutely crucial.
Yeah.
Fasting isn't suitable for everyone, especially those with advanced disease malnutrition
Okay.
or certain medical conditions like kidney problems.
Right.
A doctor needs to assess your individual situation and guide you safely.
That makes perfect sense. You wouldn't start any new treatment without talking to your doctor.
Right.
And fasting is no different.
Exactly.
But even if you're deemed healthy enough for fasting, there are still things you need to be mindful of, right?
Absolutely. Hydration and nutrition are key.
Yeah.
Even though you're restricting your eating window, you need to make sure you're getting enough fluids and essential nutrients when you do eat.
Right.
Dehydration is a risk, especially for people with multiple myeloma who may already have issues with calcium levels.
So it's not just about skipping meals willy-nilly. It's about being strategic and mindful.
Exactly. And listener, I want to address you directly here.
Okay.
This information is fascinating.
Yeah.
And the potential benefits are exciting. But it's not something to jump into lightly.
Okay.
If you're considering incorporating fasting into your multiple myeloma management plan,
Right.
talk to your doctor.
Yeah.
Get personalized guidance.
Mm-hmm.
And proceed with caution.
That's such an important point. Knowledge is power, but it needs to be applied responsibly.
Absolutely.
Speaking of knowledge, we have one more area to explore from your research. Amyloidosis.
Okay.
You mentioned it earlier as a complication of multiple myeloma,
Yes.
but it seems like it deserves its own spotlight.
You're absolutely right. Amyloidosis is a serious condition that can develop as a consequence of multiple myeloma.
Okay.
And it's crucial to understand what it is and how it impacts the body.
Right.
As we touched on earlier, it involves the buildup of abnormal proteins called amyloids in various organs.
And this protein buildup can cause all sorts of problems depending on where it occurs.
Precisely.
Okay.
If amyloid deposits accumulate in the heart, it can lead to heart failure,
Oh, wow.
causing shortness of breath fatigue and swelling in the legs and ankles. If the kidneys are affected, it can impair their ability to filter waste products from the blood, potentially leading to kidney failure.
So it's like these amyloid proteins are gumming up the works of these vital organs.
That's an excellent analogy, and it doesn't stop there.
Oh, no.
Amyloid deposits can also affect the nerves, leading to numbness, tingling, and weakness.
Okay.
A classic example being carpal tunnel syndrome.
Right.
And remember those raccoon eyes we talked about? That's another potential symptom.
Right. The bruising around the eyes, definitely memorable.
Yeah.
But how does all of this fit into the bigger picture of multiple myeloma and its treatment?
That's where things get really interesting.
Okay.
The presence of amyloidosis can significantly complicate the management of multiple myeloma.
Okay.
It adds another layer of complexity to treatment decisions and often requires a multidisciplinary approach,
Yeah.
involving specialists from various fields like cardiology, nephrology, and neurology,
Mm-hmm.
in addition to the oncologist managing the myeloma itself.
So it's like a team effort to address both the cancer and the consequences of the cancer.
Exactly. And this highlights the importance of early diagnosis and treatment for multiple myeloma.
Right.
The sooner the cancer is detected and managed, the lower the risk of developing complications like amyloidosis.
This is all very sobering, but I know we need to talk about prognosis and survivorship as well.
Yes.
What can someone with multiple myeloma realistically expect?
It's important to be honest and upfront about this.
Okay.
Multiple myeloma is a serious disease, and while there have been tremendous advances in treatment, it's still considered incurable in most cases.
Right.
However, many people with multiple myeloma achieve remission with treatment, meaning the disease is no longer actively progressing.
So there is hope for a good quality of life even if there's no cure.
Absolutely. People can live for many years with multiple myeloma, especially with early diagnosis and effective treatment.
That's good to know.
But it's also important to be aware that relapse is common, meaning the cancer can return after a period of remission. This is why ongoing monitoring is so critical.
Okay.
Regular blood tests, imaging scans, and sometimes even bone marrow biopsies
Right.
are necessary to detect any signs of recurrence early on.
So it's like a lifelong journey of managing the disease.
In many ways, yes, and survivorship comes with its own set of challenges.
Okay.
People who have undergone treatment for multiple myeloma may experience long-term side effects from the medications or procedures.
Yeah.
And they're at a higher risk of developing secondary cancers due to the impact of treatment on the immune system.
It sounds like a lot to cope with, both physically and emotionally.
It can be, and that's why support systems are so crucial.
Yeah.
Connecting with other people who understand what you're going through,
Right.
whether it's through support groups, online communities, or simply talking to friends and family,
Yeah.
can make a world of difference.
That's true.
And remember, advances in multiple myeloma treatment are happening all the time.
Okay.
New therapies are being developed,
Mm-hmm.
and researchers are constantly learning more about the disease.
That's good to hear. It sounds like knowledge really is power in this case, both for patients and for the medical community working to find better treatments.
Absolutely.
Now, before we wrap up part one of this deep dive,
Yeah.
you had some specific questions you wanted us to tackle.
Right.
These are great questions, and they really get to the heart of what people want to know about multiple myeloma.
Absolutely. Let's dive right in.
Okay, first question. What is the first sign of multiple myeloma?
That's a great question because early detection is so important.
Yeah.
As we discussed earlier, bone pain is often the first symptom people notice.
Right.
especially in the back, hips, or skull. It might feel like a persistent ache or stiffness.
Okay.
But here's the tricky part.
Yeah.
These symptoms can be easily dismissed as just getting older or being overworked.
So it's important to pay attention to your body and not just brush off those aches and pains as normal wear and tear.
Exactly. And if the pain is persistent, worsens, or is accompanied by other symptoms like fatigue, weakness, or recurrent infections, it's definitely time to see a doctor.
Okay, next question. Can fasting cure multiple myeloma? I think we've already touched on this.
We have.
But it's worth reiterating.
Absolutely. And the answer, unfortunately, is no.
Yeah.
Fasting alone cannot cure multiple myeloma.
Okay.
It's not a substitute for conventional medical treatment.
Right. It's a complementary approach.
Yes.
Potentially enhancing the effects of treatment and promoting overall well-being. But it's not a cure in itself.
Exactly. Now, the next question is a tough one.
Okay.
How does multiple myeloma cause death?
Yeah.
We've talked about the various complications.
Right.
But this question gets to the heart of the matter.
It's a question many people are afraid to ask but need to know the answer to.
That's true. And the honest answer is that multiple myeloma can be fatal due to the severe complications it can cause.
Right.
We're talking about things like overwhelming infections, often pneumonia, that the weakened immune system can't fight off.
Yeah.
Kidney failure is another major concern, as is severe bone damage that can lead to immobility and other health issues.
So it's not the cancer itself that directly causes death.
Right.
But rather the domino effect of complications that can arise.
That's a good way to think about it. And this brings us back to the importance of early diagnosis and aggressive treatment.
Okay.
To prevent these complications from developing in the first place.
Okay, next question. Are there survivors of multiple myeloma? I'm sensing a theme here.
Yeah.
And it's about hope.
Absolutely. And the answer is a resounding yes.
Good.
Many people with multiple myeloma achieve remission.
Okay.
Meaning the disease is no longer actively progressing.
Right.
And they can live for many years with a good quality of life.
So there is hope for a long and fulfilling life, even with this diagnosis.
Absolutely. But it's important to acknowledge that survivorship comes with its own set of challenges.
Okay.
People who have undergone treatment for multiple myeloma may experience long-term side effects from the medications or procedures, and they're at a higher risk of developing secondary cancers due to the impact of treatment on the immune system.
It's a lot to navigate, but it sounds like there are resources and support systems available to help people through this journey.
Absolutely. And the last question we have for this part of our deep dive is, what is the role of M protein in urine? This takes us back to the diagnostic process we discussed earlier.
Right. The M protein was that calling card for the disease?
Exactly. The M protein or monoclonal protein is a type of antibody produced by the cancerous plasma cells.
Okay.
It's not normally found in urine.
Right.
So its presence can be a strong indicator of multiple myeloma.
Okay.
Measuring the level of M protein in urine helps doctors monitor the disease, track its progression, and assess how well treatment is working.
So it's a valuable tool for diagnosis and ongoing management.
Precisely. And with that, we'll wrap up part 1 of our deep dive into multiple myeloma.
Okay.
Stay tuned for part 2, where we'll continue exploring the fascinating world of multiple myeloma,
Okay.
its potential connection with fasting, and what it all means for you.
We'll be right back. Welcome back to our deep dive into multiple myeloma. In the last segment, we covered a lot of ground, from the basics of the disease to its potential complications.
Yeah, a lot to unpack.
Now, let's delve deeper into the potential role of fasting and address those insightful questions you sent our way.
Sounds good to me. I'm always excited to explore new avenues in healthcare, especially those that empower individuals to take a more active role in their own well-being.
Okay, let's pick up where we left off.
Yeah.
We were just starting to unravel the mysteries of fasting and its potential benefits for people with multiple myeloma.
And there are quite a few potential benefits to unpack. As we touched on earlier, one of the most fascinating aspects is autophagy.
Right, that cellular self-cleaning process that gets triggered when you fast.
Exactly. And there's growing evidence that this cellular cleaning process might not only boost overall cell health, but also make cancer cells more vulnerable to chemotherapy.
Oh, okay.
While protecting healthy cells from its harmful effects.
That's remarkable. It's like hitting 2 birds with 1 stone, making treatment more effective and reducing those nasty side effects.
Precisely. And let's not forget the powerful anti-inflammatory effects of fasting.
Right.
Chronic inflammation is a known contributor to many diseases, including cancer. So anything that can help reduce inflammation is a step in the right direction.
You mentioned earlier that fasting could even have a positive impact on bone marrow health, which is particularly relevant for multiple myeloma.
Yeah.
Can you elaborate on that?
Absolutely. Research suggests that fasting might stimulate the activation of stem cells in the bone marrow.
Okay.
These stem cells are like the body's repair crews, capable of transforming into various cell types, including healthy blood cells, which are often depleted in multiple myeloma.
So it's like giving the bone marrow a boost, helping it replenish those vital blood cells that are being crowded out by the cancerous ones.
Exactly. And if we connect this back to the complications we discussed earlier,
Right.
it's quite remarkable.
Yeah.
Fasting could potentially help alleviate anemia by boosting red blood cell production,
Okay.
reduce the risk of infections by supporting white blood cell production, and even contribute to bone repair by promoting bone marrow regeneration.
Wow. It sounds like fasting could potentially tackle multiple myeloma and its complications from multiple angles.
It really could.
That's incredibly promising. And beyond the potential benefits specifically for multiple myeloma, we can't overlook the general health benefits of fasting.
Of course.
Things like improved blood sugar control, weight management, heart health, and even potential cognitive benefits.
Right.
It's about supporting overall well-being, not just targeting one specific disease.
Exactly. It's about a holistic approach to health, recognizing the interconnectedness of our body systems.
This all sounds very exciting, but I want to reiterate your earlier point about the importance of caution and medical guidance.
Yes, very more.
It's not about jumping on the latest health trend. It's about making informed decisions in consultation with your doctor.
Absolutely. It's crucial to remember that fasting is not a cure for multiple myeloma,
Right.
nor is it a substitute for conventional medical treatment.
Right.
It's a potential complementary approach that should be discussed with your doctor to determine if it's right for you and how to incorporate it safely into your overall treatment plan.
Right. It's about enhancing, not replacing conventional treatments.
Exactly.
And speaking of important considerations, you mentioned that fasting isn't suitable for everyone.
Right.
Who should be particularly cautious about fasting.
Fasting is not recommended for individuals with advanced multiple myeloma, those who are malnourished, or those with certain medical conditions like kidney problems.
Okay.
It's also crucial to be mindful of hydration and nutrition, even during fasting periods.
Right.
Dehydration can be a real concern, especially for people with multiple myeloma who may already have issues with calcium levels.
So it's not just about skipping meals haphazardly. It's about being strategic, informed, and working closely with your healthcare team.
Precisely. And listener, if you're considering incorporating fasting into your multiple myeloma management plan, please have a thorough conversation with your doctor to get personalized guidance and ensure you're approaching it safely and responsibly.
Excellent advice. Now let's address some of those specific questions you sent in, starting with this one. What is the first sign of multiple myeloma?
That's a great question because early detection is key.
Yeah.
As we discussed earlier, bone pain, particularly in the back, hips, or skull,
Right.
is often the first symptom that people notice.
Mm-hmm.
It might feel like a persistent ache or stiffness, easily dismissed as just getting older.
So it's important to pay attention to your body and not just brush off those aches and pains as normal wear and tear.
Exactly. And if the pain is persistent, worsens, or is accompanied by other symptoms like fatigue, weakness, or recurrent infections,
Okay.
it's definitely time to see a doctor.
Okay, next question. Can fasting cure multiple myeloma? I think we've already touched on this, but it's worth reiterating.
Absolutely.
Mm-hmm.
And the answer, unfortunately, is no. Fasting alone cannot cure multiple myeloma.
Okay.
It's not a substitute for conventional medical treatment.
Right. It's a potential complementary approach to support overall well-being and potentially enhance the effects of treatment, but it's not a cure in itself.
Exactly. Now, the next question is a tough one. How does multiple myeloma cause death? We've talked about the various complications.
Yeah.
But this question gets to the heart of the matter.
It's a question many people are afraid to ask but need to know the answer to.
That's true. And the honest answer is that multiple myeloma can be fatal due to the severe complications it can cause.
Right.
We're talking about things like overwhelming infections, often pneumonia that the weakened immune system can't fight off.
Right.
Kidney failure is another major concern,
Yeah.
as is severe bone damage that can lead to immobility and other health issues.
So it's not the cancer itself that directly causes death,
Right.
but rather the domino effect of complications that can arise.
That's a good way to think about it. And this brings us back to the importance of early diagnosis and aggressive treatment to prevent these complications from developing in the first place.
Okay, next question. Are there survivors of multiple myeloma? I'm sensing a theme here, and it's about hope.
Yes, absolutely.
Yeah.
And the answer is a resounding yes.
Yeah.
Many people with multiple myeloma achieve remission, meaning the disease is no longer actively progressing and they can live for many years with a good quality of life.
So there is hope for a long and fulfilling life, even with this diagnosis.
Absolutely. But it's important to acknowledge that survivorship comes with its own set of challenges. People who have undergone treatment for multiple myeloma may experience long-term side effects from the medications or procedures.
Yeah.
And they're at a higher risk of developing secondary cancers due to the impact of treatment on the immune system.
It's a lot to navigate, but it sounds like there are resources and support systems available to help people through this journey.
Absolutely. And the last question we have for this part of our deep dive is, what is the role of M protein in urine? This takes us back to the diagnostic process we discussed earlier.
Right. The M protein was that calling card for the disease?
Exactly.
Yeah.
The M protein, or monoclonal protein,
Mm-hmm.
is a type of antibody produced by the cancerous plasma cells.
Right.
It's not normally found in urine.
Right.
So its presence can be a strong indicator of multiple myeloma.
Okay.
Measuring the level of M protein in urine helps doctors monitor the disease,
Okay.
track its progression, and assess how well treatment is working.
So it's a valuable tool for diagnosis and ongoing management.
Precisely.
This has been incredibly informative, covering everything from the basics of multiple myeloma to the potential role of fasting and the challenges of survivorship. We've covered a lot of ground, and I know it might feel like a lot to take in, but remember, knowledge is power. And the more you understand about this complex disease, the better equipped you'll be to make informed decisions about your health and treatment options. You've sent us some amazing resources for learning even more, which is fantastic.
Absolutely.
Yeah.
Multiple myeloma is a complex disease, but there's a whole network of support available to help people navigate the challenges and make informed decisions about their care.
Right.
It's a journey you don't have to take alone. There are incredible resources available, from support groups to online communities, and of course your healthcare team is there every step of the way.
It seems like you're really interested in this idea of taking an active role in your own health.
Oh, absolutely.
Especially when it comes to things you can potentially control, like lifestyle choices.
That's so empowering.
Yeah.
And you're right, we've talked about the potential benefits of fasting for managing multiple myeloma,
Right?
but there might be other lifestyle factors that could contribute to better outcomes.
Things like exercise, managing stress, or even specific dietary choices.
Exactly.
It's like a whole new frontier of possibilities.
Exactly. And there's a growing body of research looking into these very questions. It's an exciting time to be exploring the interplay between conventional medical treatment and these complementary approaches.
It's like we're moving beyond just treating the disease and looking at the whole person, empowering them to take an active role in their well-being.
That's a fantastic way to put it. It's about a holistic approach, recognizing that our bodies are complex systems and that health and well-being involve a lot more than just taking medication.
Well, I think we've given you a solid foundation for understanding multiple myeloma, its potential connection with fasting, and most importantly, the absolute necessity of working closely with your healthcare team. This deep dive has been eye-opening, to say the least.
It really has. And I hope it's inspired you to keep learning and exploring.
This is just the start of your journey. Armed with this knowledge, you can have informed conversations with your healthcare providers, explore those resources you've gathered, and really take an active role in shaping your health journey.
And remember, knowledge is most powerful when it's shared and used to make informed decisions.
Well said. And on that note, we'll wrap up this deep dive into multiple myeloma. Until next time, stay curious, keep learning, and keep asking questions.